Doctor, my creatinine is 5 milligrams. Do I need dialysis? Doctor, my father is suffering from kidney disease. Will he land up in dialysis? These are the questions commonly asked to us by patients who are suffering from kidney disease. Today, in this video, I'll explain who needs dialysis, who doesn't need dialysis, and why do people panic unnecessarily. Hello, I'm Dr. Kishore Kumar, working as consultant nephrologist and kidney transplant physician at Pace Hospitals, High-Tech City, Hyderabad. First, we'll understand what do kidneys actually do in our body. We have two kidneys and each kidney has 1 million small functioning units called as nephrons. And inside the nephron, there is a small part called as glomerulus where the actual filtration of the blood happens and the urine is produced. Apart from removing waste products and excess water from the body, kidneys also help in maintaining our bone strength by producing vitamin D. They'll also regulate the blood pressure in our body, and they also maintain our hemoglobin levels, and they also maintain acid-base balance and electrolyte levels. Electrolyte levels means like sodium, potassium, calcium, phosphorus, and also acid-base, like they'll maintain the pH at an optimal level. When do we say someone is suffering from kidney failure or kidney disease? So there is a term called as chronic kidney disease. So before explaining chronic kidney disease, we need to understand a term called as eGFR or estimated glomerular filtration rate. So the word E suggests it is an estimated value. It is not a measured one. So whatever reports we see of eGFR, they are indirectly reported by putting the creatinine value into a formula, and that will throw up the value of eGFR. GFR means glomerular filtration rate. As I've already explained, glomerulus is a part of nephron, which is a functioning unit inside the kidney, and each kidney has 1 million such units. So around 1 million small glomeruli will be there inside the kidneys, and the amount of filtration which happens in these glomeruli is given by the value of glomerular filtration rate. Normal value is more than 19 milliliters per minute. If a person has a eGFR or estimated GFR of less than 60 ml per minute for more than 3 months, he is said to be suffering from chronic kidney disease. Other than eGFR, even if some person has a normal eGFR, if they are losing protein in the urine, or if they have only single kidney, or if they have a small kidney, or if they lose blood in the urine, and if these abnormalities are present for more than 3 months, even if eGFR is normal, then also it is fitting into the definition of chronic kidney disease. First and the foremost important cause of chronic kidney disease worldwide is diabetes mellitus. Second one is hypertension. Third one is glomerular diseases. I said what is glomerulus, and the conditions which affect that glomerulus can lead to kidney failure. The fourth one are the genetic causes, the conditions which run in families where some family members are also suffering from kidney disease. The fifth one is urological causes and autoimmune conditions. Urological causes like kidney stones, recurrent infections, or urinary tract abnormalities, or some autoimmune conditions like our immunity will affect our own kidneys and damage them, like lupus nephritis. So these are the common causes of kidney failure. One important point of chronic kidney disease is the kidney disease is a slowly progressive condition. Patients will not have any symptoms in the early stages of kidney failure. Majority of the patients do not have any symptoms. The answer is not every time. Single creatinine value doesn't decide the requirement of dialysis. We look at the patient as a whole. We look at other parameters like lab parameters and also the patient symptoms to decide the requirement of dialysis. The other parameters which are looked at are weight of the patient, whether he is eating well or sleeping well, or is he having any breathing difficulty, and what about his blood potassium levels or acid-base levels. So we look at all these values and then decide. If a patient has creatinine of 6 or 7 milligrams and or above that, and if he is suffering from any other symptoms like he is having difficulty in breathing because of more water in the lungs, or if he is having high acid levels in the blood, or if he is having dangerously high potassium levels in the blood, or if he is not eating well leading to weight loss, he is not able to sleep well, or he is having severe weakness, then we start dialysis in these patients. Some patients will develop symptoms, such symptoms which I have explained, even with creatinine of 6 or 7 milligrams. Some patients don't develop any such symptoms even if the creatinine is 8. So we look at the creatinine value and also the other symptoms and then decide whether the patient needs dialysis or not. The answer is yes. If we identify the kidney disease at an early stage, there are some lifestyle modifications and also some medications which can delay the progression of the kidney disease so that the requirement of dialysis can be delayed. What are those modifications or medications? The lifestyle modifications which we advise to kidney disease patients are, first and foremost, is to control their blood pressure and control their sugars and reduce salt intake, and they should also mild to moderate restriction of protein is also advised usually, and along with that they should maintain active lifestyle and also they should maintain their weight. The medications which are commonly available to delay the progression of kidney disease depends upon the underlying kidney disease. The common ones are angiotensin receptor blockers or SGLT2 inhibitors. These medications delay the kidney disease progression so that the kidney failure is delayed and the dialysis requirement is also delayed. So the bottom line of this video is creatinine value alone doesn't decide requirement of dialysis, but patient as a whole along with his symptoms and other laboratory parameters together will decide whether the patient requires dialysis or not. Thank you.